Hi everyone, so for my bioethics discussion post, I decided to choose something that it relates to nursing, but it's not specifically the nurse's job, because I think it's important to also be aware of the things that are going on around you in the hospital, as well as things that you're responsible for as a nurse. And one of those most important things is the patient and physician relationship, because we've been taught throughout our first semester that it's important to promote a good therapeutic relationship with your patients. And I think that this is also important for the nurse to be aware of when extending to the physician. And the bioethic issue specifically here that I'm going to be talking about is when you have that knowledge gap between the patient and the physician, what kind of ethical considerations do you have to worry about when it comes to that huge knowledge gap? Because nobody can know everything or the same amount that a physician's going to know when they go into the hospital. They only have their limited knowledge about what's going on with them based on, maybe Googling or what they've heard from other people, or maybe they have friends who are nurses and are like, well, this is what I've seen before. So they have this limited view of what's going on with them. So it's the physician's responsibility to be aware of that and to also try and compensate for it. The article specifically that I referenced was the physician relationships from the American Medical Association, and it pulls its information from the American Medical Association Principles of Ethics 1, 2, 4, and 8. It says essentially that because of the nature of the relationship between the physician and the patient, that it's a moral issue, because we're talking about dealing with the care of another human being, which automatically makes it an ethical issue at its core. And that relationship is inherently based on trust, because like I mentioned earlier, there's no, that knowledge gap is huge. So the patient is trusting the physician to give them not only the correct information about their diagnosis, but also education on how to cope with it and deal with it. Losing control of my camera there. Sorry. The main consideration there on that trust level is that the physician has to be aware of this trust and also not abuse it. They have to be able to put the patient's well-being above their own wants or needs. So for instance, just a very hypothetical off-the-wall example might be, maybe the physician really wants to perform, I'm losing control of my camera, really wants to perform a certain surgery, and the patient's diagnosis is close enough to where they can get them in for that surgery, and so they schedule them for their surgery when they didn't really need it. Something like that. Obviously, that's completely hypothetical and should not ever be happening anywhere. But that's kind of the whole point of this ethical issue there. The patient has no idea if they need that surgery or not, and so the physician has to be trusted to give them the proper care. I think that as far as this issue goes, on the PowerPoint, I came out as a virtue ethicist. So basically, whenever we're presented with a moral situation, we should think, how would a morally virtuous person conduct themselves in this situation? So the physician should be ensuring that proper client education, and like I said, placing the client's well-being above their own, and always attempting to give the best care that they can. It's very similar to what we've been taught for nursing as far as client education goes. Like, be open and don't ask those closed-ended questions. Make sure that you're available for questions. make sure that you have the information there, or if you don't, that you're willing, just say, hey, I need to go look this up and get you the right answer, and don't just kind of brush it under the rug and be like, oh, well, blah, 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 I'm going to pull this out of nowhere because I don't feel like researching it, but it's probably right. That would be another issue with this patient-physician relationship. It's very, very much like what we as nurses have to do, but on a deeper level, because we are teaching patients how to care for themselves and their diagnosis, whereas the physician actually needs to teach the patient about what is happening to their body with this diagnosis. It can be helpful for the physician to do this because it makes, our jobs as nurses a little bit, I don't want to say easier, but it makes it make a little bit more sense for the patient, because if they understand what's going on inside their body, as well as how to take care of it, it can help them remember and better understand how to take care of themselves. So, all in all, it's just really important for the physician to be aware of the knowledge gap between themselves and the patient, and to compensate for that. So thank you for listening to me ramble on about patient-physician relationships. Bye.